Some of the clinical applications of upregulating this nitrate to nitrite to NO pathway. Cardiovascular function. Cardiovascular disease is still the #1 killer in the United States. And they've shown by lowering the blood pressure just by 5 millimeters of mercury, decreases the risk of stroke by 34% and ischemic heart disease by 21%. Our recent study shows that Berkeley Life decreases the systolic blood pressure by 12.5 millimeters of mercury and 4.7 millimeters of mercury for the diastolic. And I did one of those max pulse endopat evaluations. And initially, I came up with type 4 for my endothelial function, which isn't very good. But after 6 months of using 2 capsules twice a day, I came out as a type 2, which is getting pretty darn good. Sexual function, male and female. So ED is ED. Erectile dysfunction is endothelial dysfunction. And often this is the first sign of cardiovascular disease. So we all know about the PDE5 inhibitors, the Cialis, the Viagra that are used for ED. However, these drugs cannot work without adequate nitric oxide. So nitric oxide is essential to get an erection, and the PDE5 inhibitors allow that erection to hang around longer. So without adequate nitric oxide, they do not work, which is why in only about 50% of those people, those drugs don't work. As females, we require adequate nitric oxide in order to be able to respond, to feel. Lubrication is nitric oxide mediated. So as women, if we aren't feeling and we're not lubricating, do you think we're interested in sex? Probably not so much. The cognitive function and neurogenesis. The brain requires optimal circulation and microcirculation in order to deliver the glucose, the oxygen, the nutrients to the cell, and clear away the debris. Long-term memory formation is nitric oxide mediated. Neuroplasticity. BDNF is nitric oxide mediated. BH4, I showed you how increasing the nitrate to nitrite to NO pathway increases the production of BH4. Not only is BH4 necessary for NOS to be coupled, BH4 is a cofactor in making your serotonin, your dopamine, your norepinephrine, your epinephrine, all essential neurotransmitters in the brain. So I use the Berkeley Life product with the synapsin, that RG3 nasal spray that you can get at compounding pharmacies, to increase neurogenesis. For exercise, adequate nitric oxide increases exercise endurance and decreases recovery time. With adequate nitric oxide, less oxygen is required. Nitric oxide regulates the blood flow, contractility of the muscles, the mitochondrial function to increase the ATP. Nitric oxide is integral in the gastrointestinal function. Nitric oxide deficiency You get gastroparesis. Nothing moves. Nitric oxide increases the mucosal blood flow and the thickness of the mucus in the intestinal tract. There was a study showing that nitrates prevented the loss of tight junctions and prevents leaky gut induced by antibiotics. They concluded that a nitrate-rich diet may prevent dysbiosis and promote GI health. So I recommend anybody that's on any antibiotics, whether it's prescription or herbal, to take a couple capsules of the Berkeley Life nitrate supplement with it to prevent leaky gut. And using the BPC 157 and the Berkeley Life, I've repaired a lot of leaky guts. Diabetes and neuropathy. Diabetics have even lower nitric oxide than a normal person. So high blood glucose uncouples NOS, which increases the oxidative stress and decreases the production of nitric oxide. And what nitric oxide is available, hemoglobin A1C binds to it, and it binds really tightly. So the nitric oxide is then unavailable to do all these good things that we needed to do. The GLUT4 receptor requires adequate nitric oxide in order to bring the glucose into the cell. Most complications from diabetes are from cardiovascular disease. You got increased cardiovascular disease, increased kidney dysfunction, increased eye issues. All of these are circulation, microcirculation, nitric oxide issues. 70% of the people with diabetes develop diabetic peripheral neuropathy, usually within about 5 years. You've got impaired blood flow. So we've been using that to bring down fasting blood glucose.